Leader of the third party.
Thank you, Honourable Speaker, and I listen with great interest to this conversation and back and forth because I agree that access to mental health care is a significant issue and problem in our province right now. Healthcare workers, Honourable Speaker, are on the brink of collapse. 1/3 of healthcare workers, maintenance, transportation, clerical, and other workers are expected to resign in the next 2 years, according to the Hospital Employees Union. 1/3 of nurses are also expected to resign, according to a separate survey in late 2021 from the BC Nurses Union. 82% of them say that their mental health has worsened during the pandemic. Thousands of healthcare workers are considering leaving their profession, in part because their workplaces do not provide mental health supports. Access to counseling, therapy, psychologists is not covered for many. The people who we depend on for care are being left out in the cold when it comes to their own mental health. Mental health care is treated as a nice-to-have, not part of the primary health care for essential workers in this province. They are burnt out, they are overwhelmed, and they're not being looked after. My question, Honourable Speaker, is to the Minister of Health. What is his ministry doing to increase mental health supports for healthcare workers?
Minister of Health.
Thank you, Honourable Speaker. This has been, I think, it's fair to say, for healthcare workers across the system, those who work in primary care, those who work as ambulance paramedics, those who work in emergency response in general, those who work in acute care, those who work in long-term care, an extraordinarily difficult period. And that's why, throughout this period, we've taken actions to support healthcare workers, actions that are unusual in the Canadian context. For example, all of the steps taken to support long-term care workers, historic steps, including, of course, the unanimous decision by this House to get rid of Bills 29 and 94, the HCAP program, which has added thousands of healthcare workers, our training programs that have supported healthcare workers. In addition, healthcare workers have come together on issues of occupational health and safety with new programs, a new system that supports those workers. And we'll continue to work to support our workers across the community. There is, and I'd be happy to provide the member with a briefing on this, extensive effort being done to support our healthcare workers, because the member is right. We not only need to recruit a new generation of healthcare workers, but we need to retain the ones we have. This is particularly true, as some members of the opposition will know, in particular communities. And that means supporting them in every circumstance. And that's what we continue to do.
Leader of the third party, supplemental.
Thank you, Honourable Speaker. It's not only healthcare workers who are, in fact, struggling with mental health and mental illness. 1 in 5 Canadians will experience a form of mental illness every year. 1 in 2 will experience a form of mental illness by the age of 40. Rates of depression and anxiety are at an all-time high. The number of people dying from a poisoned drug supply has never been higher. And when mental health and mental illness goes untreated, people end up in the healthcare system already overburdened for their unmet needs. This is adding to the burnout that we see in healthcare workers. It's costing enormous amounts of money, and it's not solving the problem. In the summer of 2020, BC Green Caucus, along with the BC Psychological Association, proposed a solution to this crisis: fund psychologists as part of primary care networks. My question, Honourable Speaker, is to the Minister of Health. This minister boasts about opening urgent and primary care networks. When can British Columbians expect to have their minds and mental health treated as part of their health and be provided access to psychologists as a standard part of primary care networks?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. The demand for mental health and substance use services already enormous before the pandemic hit has been exacerbated in every way. There's no question. And the particular burden on people working on the front line is evident to all of us in all of our communities. So we are, through every urgent primary care centre, There is access to mental health counseling. That has been, and primary care networks also has been a great help. We've also built with and for healthcare workers 2 different online platforms, one called Care to Speak, another called Care for Caregivers, both online resources that give access to free counseling, and anybody working on the front line. Know, one, that this whole legislature thanks everybody for their tremendous work, but also that we have counseling particularly tailored to the particular pressures of the pandemic available for you. More broadly, the Workplace Mental Health Hub, developed again for people during the pandemic, businesses, small businesses, hospitality, tourism, where people have been under particular pressure. That is an important piece of work. The Psychologists Association has recently given us a proposal that does fit in some ways with the mandate instruction that the Premier gave me to look at new ways, low-cost and no-cost ways for people to access counseling. That's in addition to the 49 community counseling organizations that we are funding. They are connecting thousands of people with additional supports in communities, and we're grateful to those groups that are connecting people with immediate care. And along with other proposals that we receive, we're considering the proposal of BC Psychologist Association now that they have given us a specific proposal.